Well, I think we are on time. So on behalf of the organizers of this Congress, to whom I want to thank very much for giving me this privilege of chairing this enhanced topical session on ethics and safety culture in medicine. I welcome all of you. Good morning, good afternoon, good evening. And also I have the big pleasure and honor of co-chairing this session with my colleague, Shin Thurston from UK and from IRPA. And first of all, I want to let you know that this session has the possibility for all of you to submit your questions, and you will see a particular area where you can write your questions. You are encouraged to send your questions or comments even during the session. And at the end of the session, with the support of Jim, hopefully we will go through the questions and invite the panelists to refer to that. Having said that, I will not take more of your time. I just want to very quickly to set the scene, because the topic that is gathering us today is the ethics and safety culture in medicine, and is really a very, very timely topic. We have been just discussing in a previous session basically about safety and about the bone call for action. And now we move to a complementary, a different dimension of what can allow us to achieve safety. It's a dimension, in a way, both are related to culture. We will talk about the culture of respecting the principles, the ethical principles in healthcare and in the use of radiation in healthcare. And we will talk about a culture of safety in the daily work when using radiation in healthcare. And we also discussed just a minute ago whether we can aspire to achieve zero harm from patients. And this is really probably not an achievable goal. We know that this is really not achievable. What is achievable is zero preventable harm for patients and workers. We can put this as a goal, and achieving this maximum possible preventive level of harm associated with the use of radiation is possible by implementing a culture of respect of ethical values and safety culture. You will learn more about this during this session. Very interesting is that culture is very much contextualized, very much local. So what we will listen now are the views of different international organizations and outstanding experts, but also international. And it will be interesting, if we have time, is to discuss which are the particularities of each local adaptation of these general principles that we will listen now. So without taking more of your time, I will give the floor now to our first invited speaker, Dr. Marie-Claire Cantone. She is professor of physics at the Milan University, is a member of the IRPA Executive Council, chair of the IRPA Task Group on Implementation of the High Dose Limit, and also vice chair of the expert group on NEA CRPPH, also on the same topic. She's member of the IRPA Committee 3 in radiation protection in medicine, and she's co-chairing a task group of IRPA on ethics on radiation protection in medicine. And she was also co-author of the previous IRPA report on ethical foundations of the system of radiological protection. So Marie-Claire, the floor is yours now.